I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. And in this video, we're going to discuss how the mealtime insulin, basically the insulin Lispro and the insulin Aspart, work to control your post-meal blood sugar spikes. Without further ado, let's get started. So let us say if someone has type 1 diabetes, in that case, they need to be both on mealtime insulin injections along with basal insulin injections such as Lantus or insulin detimer. But let us say if someone has type 2 diabetes, obviously we don't start insulin injections in patients with type 2 diabetes right away. But let's say if the type 2 diabetes is worse, or let's say the type 2 diabetes is getting worse, then we would consider insulin injections. So usually my go-to for type 2 diabetes insulin injections are usually 70-30 insulin injection. So basically this is a combination of a short-acting insulin as well as an intermediate-acting insulin, and these will be like 2 injections per day. But let's say if someone wants to consider a different injection, so in that case, usually for type 2 diabetes, we start them on a basal insulin. So we'll start them on a basal such as like insulin Lantus or insulin detimer initially, and our focus would be to get their fasting blood sugar under control. But let's say we get their fasting blood sugar under control, and in spite of that, if their blood sugars are still high or the A1C is still high, like let's say more than 7, in spite of getting the fasting blood sugar under control, then we consider mealtime insulin injections such as the Humalog or the Novolog. So understanding how insulin works in a non-diabetic patient is really important. So if you've not checked out that video yet, I would highly recommend to check out that video. I'm going to put that video in the description box below. So now let us understand how the mealtime insulin works. So usually in a non-diabetic person, the moment we eat, our blood sugar rises. The pancreas starts secreting the insulin right away. Since the insulin is secreted in the blood, it has a very quick onset of action, and the body keeps adjusting the insulin secretion so that the blood sugar never rises more than 140 mg per deciliter, and at the same time never drops less than 70 mg per deciliter. However, when someone has severe insulin resistance like in type 2 diabetes or insulin deficiency like in type 1 diabetes, the body is unable to produce enough insulin rapidly to keep their sugars under control, which causes the blood sugars to spike after a meal. So let us say we compare 2 people. So one has diabetes, the other doesn't have diabetes. The one who has diabetes is also on insulin injections. He knows the exact right dose of insulin to take before meals. So let us say if both ingest soda. So by ingesting a soda like a Coke or maybe like a fruit drink or something like that, so the blood sugar rises quickly in a non-diabetic person, but then the insulin has a very rapid onset of action and thereby getting the blood sugar back to normal range. However, in a diabetic person, in spite of making sure that he takes the right amount of insulin injection 10 to 15 minutes before meal, still his blood sugar might spike up to 200 or so before it comes back to normal. And the reason for that is because in spite of all these years, still we're not able to mimic the exact way our body, or basically our insulin, regulates our blood sugar. So this is why sometimes if someone has diabetes, they need to be a little bit more disciplined to get their diabetes under control. So this is why when you choose carbohydrates, you should choose a slow digesting carbohydrates like unprocessed grains such as quinoa, buckwheat, brown rice, steel-cut oats, to name a few. So they all get absorbed slowly in the body, and thereby the insulin injections can do a better job preventing the sugar spikes compared to fast-acting carbohydrates like processed sugar. Remember, a non-diabetic person can also develop insulin resistance and type 2 diabetes if they continue to indulge in fast-acting carbohydrates all the time. And obviously, the threshold for developing type 2 diabetes depends on each individual. So insulin Lispro, which comes as Humalog, and insulin Aspart, which comes as Novolog, are the 2 most commonly prescribed mealtime insulin injections that I prescribe. However, sometimes I do prescribe regular insulin, which is also a short-acting insulin. The only reason that I would prescribe this insulin if the person is not able to afford this newer insulin injections. So both Humalog and Novolog, which is basically the insulin Lispro and the Aspart, they start acting around 10 to 15 minutes after the injection. So once you give an injection into your fat tissue, it takes almost like 10 to 15 minutes to start acting. And then they peak around like 45 to 90 minutes. So that's at the peak action of insulin is. And it lasts for almost 3 to 4 hours. So let us say your meal contains fast-acting carbohydrates like dosa, white rice, or chapati, or white pasta, or quick oats. Then injecting into the abdomen might be better, as they tend to produce the fastest absorption, followed by the arms and then their legs and then the buttocks. So let us understand this further. So let us say you have a pasta from a refined wheat flour. So this basically means that this is a fast acting carbohydrate. and let us say you took the injection 10 to 15 minutes before that meal. So what that means is that the blood sugar is going to spike. And let's say you check the blood sugar around 2 hours after meal. And let's say your blood sugar is around like 250 or so. You have to understand that around at the 2 hour mark, you still have some amount of insulin that has not completely finished its action. So what that means is that, so let us say around 2 hour mark. So let us say somewhere here, and your blood sugar is around like 250 or so. So what that means is that, let us say you decide to do a correction insulin, then there's high risk for low blood sugar happening, because the correction insulin is going to start peaking and is going to bring the blood sugar down. So usually what I would recommend would be, so let us say you inject a mealtime insulin, and after that you want to make sure that you check your blood sugar on around 2 hours or so, and then check again around like 3 to 4 hours or so. So at that time you can be confident to say that all the insulin that you injected is pretty much has done its job, so that you can give a proper correction insulin. Otherwise the risk of low blood sugar is still high. So how about regular insulin? So even though we don't use this a lot nowadays, it's still good to know about this particular insulin too. So regular insulin starts acting around like 30 minutes after meal, which means that you have to inject the insulin somewhere between 15 to 30 minutes before the meal. And after that, its peak action is around like 2 to 4 hours, and it takes almost like 5 to 6 hours to finish its complete action. So let me give you a tip here. So let us say you went to the ice cream shop and you had an ice cream, but then you forgot to take your insulin with you, and now you went home and your blood sugar is almost like 300 or 350 or so. So let us say now you're planning to give a correction insulin, but the correction insulin is going to take almost like 3 to 4 hours to get the blood sugars under control. And you're also thinking about like maybe I'll go for an exercise, and that will also help to bring the blood sugar under control. So in that case, what I would recommend would be, let us say if you want to bring the blood sugars back to normal quickly, you can inject the insulin in the exercising area. So let us say if you're planning to go for a jog, you can inject the insulin onto the thigh, and thereby when the blood flow goes high as you're exercising, then the insulin can have a rapid onset of action, so that it can bring the blood sugar back to normal quickly. However, there's always a risk for low blood sugar if you continue to exercise for quite a while. But again, before doing that, it's important to make sure that your blood sugars have not been elevated for quite a while, because sometimes your blood sugars might be 300, 350, and let's say it's been elevated for quite a while, maybe like 7 hours, 10 hours, or maybe like 2 days or so. In that case, you might be having elevated ketone bodies, which means that you're at increased risk for ketoacidosis. So in that case, you probably have to check your ketones in the urine. But so let's say you were 100% sure that the blood sugars were completely normal just few hours before, and this blood sugar spike happened after an ice cream, then you can use this tip. However, if you're well-controlled diabetic and you exercise regularly, in that case, I would recommend injecting into the abdomen to avoid risk of low blood sugar during exercise. So let us say you're a type 1 diabetic. In that case, you'll work with your doctor to find the right insulin-carb ratio and also your correction factor to get your blood sugar back to normal if it is elevated. But let's say if you have type 2 diabetes, then usually the doctor will prescribe you the amount of insulin that you take before a meal, and then he might sometimes provide a correction factor also. So usually in my practice, I start patients with basal insulin first. And let us say after I get their fasting blood sugars under control, if the A1C is still high, then I would add mealtime insulin for just one meal, which might be the largest meal of the day. So let us say if someone is taking, let us say someone is taking 20 units of Lantus, so basically they're taking 20 units of basal insulin. In that case, I probably might start anywhere between 4 to 5 units of the short-acting. So I'll probably start with 4 to 5 units of either Humalog or Novolog during the largest meal of the day, and then try to adjust the insulin accordingly. But let us say if they're having multiple post-meal spikes, in that case, I might probably increase the frequency of the mealtime insulin injections. Sometimes might end up going to three mealtime insulin injections along with the basal insulin injection. I hope you now understand how mealtime insulin injections work. By understanding this information, you'll be able to optimize your blood sugar control. If you found this video helpful, I'm going to ask you a small favor. Can you please hit the like button so this video can reach more people? And if you have any questions, comments, please post in the comment box below. If you want to know more about basal insulin, basically the insulin Lantus or insulin Detimer, then check out this video here. If you want to know more about the insulin 70/30, basically a combination of short-acting and intermediate-acting insulin, then check this video here. And I'll see you in my next video. Until then, goodbye.